Sorry, I think there's a problem with the computer. And okay, yeah, let's continue. So when it comes to the goals of treatment, curative means that there's a chance that there's a reasonable and realistic chance that the cancer will be gone completely for at least 5 or 10 years after the initial treatment. Whereas palliative generally refers to a very advanced stage of cancer that we will not be able to get rid of the cancer completely, but we would be able to control it. So either way, it means that the cancer is treatable. It's just that the goal of treatment is different. And so if you do not feel like you clearly understand these three things, then you should definitely ask your oncologist to clarify, so you know what your diagnosis and your situation is. So in terms of the principles of cancer treatment, and we have two. One is attacking the cancer. The other one is supporting the whole person. So when we talk about cancer treatment, we often refer to attacking the cancer directly. So that's all the treatment that we use routinely, including surgery, chemotherapy, and radiation. And then we have newer treatments like immunotherapy, we have hormone therapy, cellular therapy, and so forth. And these days we have developed special procedures like ablation or tumor injection. Okay. And in terms of supporting the whole person, that is also important. I think sometimes it's even more important than attacking the cancer, because we have to make sure your body is able to handle. Yes. Can you guys hear me?
Hey, sorry about that. I can hear you. Oh boy.
Oh, okay, good. Yeah, I think there's a problem with the computer, but
okay.
I think I'm back on.
Okay.
Okay, good. Yeah, thanks for checking. In terms of supporting the whole person, we want to consider the biopsychosocial aspect. So it's not just your body, but also your mind, spirit, and emotions. We need to focus on symptom management and improve your quality of life. And this is also where we use nutrition and other lifestyle measures to help. And we focus on recovery and rehabilitation. And I like to use the gardening analogy again. So attacking the cancer is like removing the actual weeds from your garden. But after you remove the weeds, we have to help your garden recover. We need to give it enough clean air, water, fertilizer, and sunlight, and so forth. So that's more like the supportive, and recover after a cancer treatment. And some of you may wonder, what goes through the doctor's mind when we decide on cancer treatment, and how do doctors decide what treatment to use and what not to use, and so forth. So our medical knowledge primarily comes from what we call the standard guidelines from National Comprehensive Cancer Network. Now, this is a alliance of 30 well-known cancer centers in the country. And within these cancer centers, the internationally renowned cancer experts, they meet up with each other several times a year, and they go through all the research done on cancer in the entire world, and they sorted out what treatment works best, what doesn't work, and how it's best to treat the cancer. And basically, they put together these almost like a treatment protocol to share with the rest of the world. And that's what we call NCCN guidelines. So this is one of the examples here. It's basically like a workflow type of protocol If, for example, certain cancer should be treated by this treatment, if the treatment stops working, then we use the second treatment, and if it doesn't work, then we do certain other treatment and so forth. So these are actually guidelines that everybody uses, whether someone is at Harvard or Seed of Hope or someone like us in the community. And it's actually internationally based. So people in Asia, Europe, they also follow these same guidelines because American medicine, when it comes to cancer treatment, is really considered the most advanced in the world. So these are considered the gold standard treatment recommendation. Besides these guidelines, we go to conferences, we get educational materials from various organizations. We sometimes discuss your cases at tumor board. That's when we have surgeons and pathologists and all the other specialists get together to discuss your case in detail. And of course, we cannot make treatment decision just based on these guidelines alone, because otherwise a computer can do that. And that's why we combine that with our practice experience and in consideration with the clinical information, such as your age, how strong you are, something called performance status. So if you're stronger, then you may be able to tolerate more treatment. We consider your medical history, the medications that you take, also your psychosocial situation, such as transportation, family support. We go through your blood tests, look at your physical exam. And besides this, we also do a lot of behind the scene work. So even though we only see you maybe for 10, 15 minutes in clinic or talking on the phone for a few minutes, but we spend hours every day behind the scene, talking to radiologists about your scans, talking to your surgeon about what happened, what they found in the surgery, and we go on to have to connect with your insurance to appeal for certain things, and so we do a lot of things that you may not know about. So at the end, we combine all of these into what we call a patient-centered care. So we develop individualized plan for each person, and then we bring to you these various options that we think are medically reasonable, and then we would typically ask you and your family for your wishes and goals, and to determine what type of option is best to fit your specific situation. This is a process, what we call shared decision making. So we make decisions together in a shared manner. So in terms of decision making from patient perspective, once you get the information from your doctors, it's important for you to carefully review all the information very closely. It's important to take notes and ask a lot of questions. And I think it's important to have a family member at least present to have additional set of ears to understand what's going on. And these days, if we do a lot of telephone appointment, then it gets a little bit easier because they can be always on the call too. And try to understand the pros and cons of treatment options, and especially consider your personal preferences, values, and your specific situations. Because when we recommend these treatments, it really means different things to different people. And for example, if a treatment only works in 10 or 20% of the time, some people think it's really high percentage, whereas others may say that's really not worth it to do. So always consider what we tell you in clinic in the context of your preferences and your values, and always feel free to share your thoughts. So if you're interested in aggressive treatment, or if you're really afraid of the chemo side effects, then make sure you make yourself known to the staff, so that we can take that into consideration when we determine your treatment. And it's important to use reliable resources to study cancer. And there's so many things online these days, and it's very easy to get into some of the wrong information on there. So anytime if you find resources, information on university websites, they tend to be very reliable. Any university center, big cancer center, or the national organizations like American Cancer Society and so forth, those would be the places that I would recommend getting resources from. Another thing to pay attention to is how to manage opinions from family members, caregivers, and others. Because once people know that you have cancer, then a lot of well-intentioned people will, give you information. They will tell you, I heard this is good, that's good, and my family member or somebody else used to do this, and then their cancer is cured. And oftentimes you get a lot of disagreement and conflicting information, and that's really, in my experience, a lot of, confusion and sources of stress. And it's important to consider whether those people know you well enough to help you make decisions. And also, cancer treatments are changing so much these days. So if it's some treatment that people had 5, 10 years ago, these may already been outdated now. And because there's so much research going on, cancer is just treated very differently compared to, say, 10 years ago. And it's also important to not rush into major decisions. And as I mentioned before, cancer is more or less a chronic condition. So it's okay to wait, a day or two or even a few days to make major decisions. It's better to take your time to really consider all the factors before deciding on something, rather than rushing into something and then regret or wanted to change your mind later. So another thing that patients are often very concerned about is costs. Cancer treatment is getting so expensive these days that it's rising, as you can see on the curve here, it's rising a lot faster than inflation or other healthcare expenses. And it's estimated that almost 50% of patients exhaust all their entire life savings just within 2 years after cancer diagnosis. And we're talking about patients who have healthcare insurance. And even with insurance, and there's so much copay, deductible, there's out of pocket for different things. You may need to hire caregivers or transportation, and sometimes you have to get over-the-counter medications, and none of these is covered by your insurance. And that's why we see this very sad situation. So it's important to understand your insurance plan and benefits very well. We have in our clinic a financial counselor who will give you information about copay on the medication and how much deductible and so forth. There's also a case management team at FP Management and BIFO who can help you understand the exact insurance benefits. And if your drug copay is high, we typically like to, we will help you look for foundations, charity programs, and assistance program to help get the copay lower so it's more affordable. And if that's not feasible, then it's okay if you ask your physicians to see if there's any other reasonably good treatment that have less copay. And sometimes we have to consider a very dire question of whether it's worth it or not, because some cancer treatments work well, but some really doesn't work that well. So if certain cancer treatment can only help someone live additional 3 months, whether it's worth it to exhaust your entire life saving or even go bankrupt for that. So it's a very grim question, but I think it's a realistic question that we need to touch on if the situation is there. So after you finish your cancer treatment, generally if it's an early stage cancer, then the treatment will be for like 3 months, 6 months, or sometimes a year. And afterward, you will be done with your cancer therapy. And we'll go on to this phase of treatment called cancer survivorship, meaning that we monitor your cancer regularly. We check to make sure the cancer doesn't come back. So how often we see you in clinic and whether we need to do blood tests, scans, and so forth, it really depends on your specific type of cancer, your stage, and your situation. Unfortunately, we really don't have the perfect test or scan to make sure the cancer is gone completely, because there's always microscopic cancer cells that scans and blood tests cannot show. And a lot of people get into anxiety issues with the scan, so-called scanxiety, because some people live from one scan to another. If you get one scan every 6 months, then you get so nervous and anxious about it, and it's not healthy for you to live like that. So we want to always relieve your anxiety if possible. And The other thing that's important after cancer treatment is to learn how to cope with the aftermath of cancer, such as side effects that's left over from cancer treatment. And these could be like nerve pain, could be fatigue, and other symptoms. If the cancer is advanced, then we generally continue with long-term treatment, and obviously that means continuous follow-up and support. And throughout this time, even after you finish your cancer treatment, it's really important for you to maintain your general health, such as taking good care of yourself and living a healthy lifestyle. And this brings up an important point of the primary care and oncology collaboration. So even throughout the cancer treatment and even after cancer treatment, it's important for you to continue to see your primary care doctor regularly because they see you from a different angle. From oncology standpoint, we see it through your cancer and we try to get rid of the cancer or control it as much as possible. But your primary care doctor sees your entire body, entire person, considering all the other medical conditions that you have. And also some medical conditions can affect cancer, and cancer treatment can affect some of your existing medical conditions. For example, some cancer medicine makes diabetes and hypertension worse. Sometimes heart disease can limit the certain type of cancer treatment that we give you. So we may need you to go back to your primary care doctor sometimes to get certain things fixed up before continuing treatment. And every time you see us in our clinic, we always send a report to your primary care doctor the next business day. And this report will be posted on the computer, on the electronic records, so that all the other staff at Vivo will be able to see our report to your doctor. This is a question that people often ask me, if it's a test ordered by primary care doctor, do we get the results? We do get the results, but we have to look online to get them so that basically the results, they don't come to us directly if it's ordered by your primary care doctor. But if you let us know that your other doctor ordered something, then we can go online to get the results of that too. And similarly, if we order the test, these tests may or may not go to your primary care doctor. They will come to us directly, but not necessarily to your primary. So again, for those situations, we can send those to your primary care, and then they can get posted online too. And deciding what issues to discuss with primary, I think it's important. Generally, if it's cancer treatment related, then it's better for you to talk to the oncologist. But if it's non-cancer related type of things, then you can talk to your primary. And if you're not sure, you can always call us, and then we can tell you, this is an issue that's better to be addressed with your primary care doctor. Or if you talk to your primary care doctor and they say call oncology, then feel free to call us, and then we'll help you take care of that. From time to time, people have asked me about referral to tertiary centers, and these are like, say, university centers like UCLA, Loma Linda, or Cedar of Hope, or other places. And I would say majority of the time that's not really necessary because, as I mentioned before, we all learn from the same protocol, the guidelines. So we more or less do the same or make the same medical recommendation. We generally like you to have cancer care that's close to home and your family. We don't want you to drive, 1 or 2 hours away. That's not having enough support from the family. And most importantly, we want you to get cancer care, that's connected to your primary care doctor and the medical group. And because we have worked with your Vivo Medical Group and your primary care doctors for a long time, we can access their reports and everything else more easily. And if you do want to have a second opinion, we have other physicians available within our network, but at different clinic sites, so we can always arrange for that too. Now, there are some situations where you have to go to a university center. For example, if it's a bone marrow transplant that we cannot do here, then you have to do somewhere else. Certain types of cancer are really rare that we don't see too often. So in these situations, when your oncologist feel that they're not able to treat your cancer locally here, then they would make the recommendation to your medical group for you to see, go to other places. But if your doctor recommends you to get treatment here, then that means we feel very comfortable that the treatment will be the same whether you do it here or there. And if you go to other places, make sure you keep your own records, such as a CD of the scans and lab reports, because when you go outside of the network, then it's very easy to get lost. We have a lot of communication issues, like fax reports get lost, and then medical records don't transfer correctly. So if you do go outside, make sure you're very proactive with the follow-up. And clinical trial is one of those things that some people prefer, but a lot of people don't like them because these are basically experiments done on people. They're testing new medications to see whether it works. And sometimes it could be good options if we don't have any other medicine available, but it's something that you have to think seriously about because these are medical treatments that we don't know too much about. And it may work, a lot of times it may not work, and then there may be some side effects that we don't know about yet. And next, I want to talk about exploring other options. So it's common, in your mind to think that, whether there's other options besides chemo and surgery and so forth out there. And you get a lot of information online or a magazine. They talk about all these alternative cancer treatment. And so there are two forms. One is the alternative medicine, which means you choose it instead of the standard cancer treatment. And I really do not recommend this because this leads to significant delay in cancer care. I have had a number of patients in the past who choose this route, and I've never seen any good outcome yet. And the other option is what's called integrative medicine, meaning that you integrate some of these less conventional things along with your cancer treatment, and it may be potentially helpful in some situations. And these are the common ones that my patients have used in the past, including some dietary supplements, lifestyle changes, counseling, acupuncture, massage, healing touch, meditation, yoga, and support group, and so forth. And these are mostly pretty safe, and we use these as a support to help your body feel better and get better. So they don't kill cancer cells directly, but they complement very well when it comes to cancer treatment. And so it's just important for you to be open with your providers. Always let them know what supplements you're taking, what other things that you're doing, so that we can look up and make sure there's no interaction with your current cancer treatment. As I mentioned before, I'm an advocate of lifestyle medicine, which is a simple and powerful therapy. And lifestyle medicine consists of 6 major, what we call pillars of lifestyle medicine. And these are nutrition, exercise, stress management, sleep, healthy relationships, and avoidance of substance abuse. And throughout the rest of the year, we have various people to talk about these components later on. But just to briefly go over these, in terms of nutrition, typically we recommend a whole food plant-based diet, meaning that food that's not processed, food that's low on sugar, salt, and grease, and food that's primarily plant-based. So not necessarily vegan or vegetarian, but predominantly plant-based food would be better. So in terms of exercise, 30 minutes of moderate exercise daily. You can try some muscle resistance exercise 3 times a week, like lifting light weight, just a few pounds. And it's important to not to exhaust yourself too much. I see a lot of people try to do really strenuous exercise, hoping that that will be healthy for the body. But in the process, you can really hurt yourself, right? It can hurt your joints. It can exhaust yourself too much sometimes. That makes you worse than better. So even just 30 minutes of walking, gentle exercise, moving your arms and legs, any kind of movement would be helpful. In terms of stress management, try to identify your stressors, what makes you stressed out, what makes you more calm down, and try to learn ways to cope with them. Things like meditation, yoga, breathing exercises, and just walking around, talking to people, whatever that works best for you would be important. It's important to make sure you sleep well. We recommend at least, typically 7 to 8 hours, but most people cannot sleep that much, but at least adequate sleep to help you function well. And important to keep in mind that sleep medicine, even though if you take them, it makes you feel like you're sleeping. But then when you analyze people's brainwave when they're on sleep medicine, their sleep pattern is actually different. So you don't get to the same deep quality sleep that you would do with if you don't take the sleep medicine. So always better to avoid sleep medicine if possible and try to use other ways like relaxation to help you sleep instead. It's important to establish a healthy relationship, having a purpose in life, and having a healthy support system so that you can pursue healthy lifestyle changes. And obviously avoid cigarette smoking if possible and excessive alcohol use. And if you guys are interested to learn more about this, there's a website I recommend my patients to go to. It's called anticancerlifestyle.org. And this is an online course. It teaches you all of those 6 pillars of lifestyle medicine and how to actually bring that to healthy lifestyle change. This is also free, but they accept donation. So you can go on there, sign up for the course, and take at your convenience. So just several special notes for caregivers. We know that cancer affects more than just the patient, and it also affects everyone around them. So I feel that oftentimes the caregivers' roles are not emphasized enough. We pay a lot of attention to the patients, but in reality, I think the caregivers have to be careful as well because it is really stressful on them to live with someone or care for someone who has cancer. And patients are actually quite concerned about caregivers too, because time and time again, research have shown that patients are worried about the stress and the burden on their family members. They have to take them to doctor's appointment, they have to miss work, and they worry about impact on their financial issues and career. So there are several things I want to mention here. One is it's sometimes the caregivers are overly concerned about patients' activities, like the patient not eating enough or they're not doing enough exercise and so forth. And it could be frustrating to both the patient and the caregivers. But I think it's important to sometimes give the patients a little bit more space. Otherwise, you can put a lot of stress on the patients. And it's important to understand that for someone who is living with cancer, some days they feel better than others. So some days people may have more appetite, may have more energy to deal with, to go exercise or do other things. But some other days really don't feel like eating that well and don't feel like doing much. So on the days that patients feel well, you can try to encourage them to eat more and do more. But on the days that they don't feel well, then try to take it easy and not give too much pressure for them to do a lot of things. And just always be patient and empathetic. Also, make sure to respect the patient's wishes. And sometimes I see situations where, family members, they want to do things that they want to do, but not necessarily what the patients want to do. And again, a lot of statistics and research and surveys show that consistently patients value independent decision making. So it's important to respect what patients want, not necessarily what the family members or other people want. And we also see the situations where different people in the family, they want different things. So there could be a lot of disagreement, and this is really not the time to have arguments with each other in the family. And we want to have everybody work harmoniously together to help our patients. So really important to work together and closely with all the involved parties and put together a plan that's happy to everyone. This is just the last couple of slides. And coping with cancer, it's important to be hopeful and positive, but yet be realistic. And we're going to have more talk later, specifically on coping with cancer. It's important to avoid self-blame and self-hate. And it's really not healthy for your body to always have this hate in yourself because you got sick, but rather try to practice self-compassion and just having this compassionate feeling for not just other people but your own have been shown in research to be beneficial for your health and well-being. And these are some other things that patients have told me in the past that helps them cope with cancer. And cancer gives people generally a new perspective on life. So you can set priorities differently. Like if you have limited energy, then you may want to do things that is most important to you, and because you don't have opportunity to do everything. Focus on present moments. So every day that you feel well is considered a good day. You may not be able to, consider what happens, a few years down the road, but at least, in the short term, focusing on quality of life, focusing on keeping yourself happy and healthy would be a good way to look at it. So see cancer as a journey. Generally, I don't like to think of cancer as a quick fix. It's not something that you have surgery done and then you're good forever, but rather see it as a journey because you want to use it as a motivation to change. It's a wake up call. It's something that you have learned this lesson and you want to correct whatever that might have caused the cancer, so the cancer doesn't happen again. And people also tell me that cancer is an opportunity to connect with loved ones on a deeper level. And always remember that there's always something that can be done, regardless of what situation you're in. Even if cancer is not curable, then we have methods to control them or to stabilize them. And even if a cancer is not controllable, then we have medication, we have other methods to help you with symptoms, with side effects, and so forth. So whatever the situation is, there's always something that can be done. And cancer patients often worry about abandonment. They worry about feeling abandoned, but really, in any situation, we can always do something to help. So one thing that I always like to study is the holistic healing philosophy and how that can be incorporated into our daily medical work. So if you're also interested in learning about kind of a holistic perspective of healing, there are three concepts that may help you improve your health and well-being. One is flow, the second one is reserve, and the third one is balance. And flow is a very important concept because whenever there's flow, there is health. Just like a garden, when there's flowing water, then the water is not stagnant. The water is nice and healthy. So the same thing happens in our body. When things flow well, then you feel good, such as flow of the air, and that's why it's good to learn to do some breathing exercises. You can learn those online or on YouTube. There's a lot of good information on that, breathing techniques to help you relax. We want to encourage flow of things through your gastrointestinal tract. So if you're constipated, if you have GI issue, it's good to resolve that. We want you to have a good flow of the urinary system. So make sure you hydrate yourself so that you can urinate well and flow well. We want to develop good flow of blood through your body. So exercise, move around, and that will encourage blood flow. And most importantly, we want you to have flow of emotions. If you feel like you're emotionally stuck on something, then it's never good for your body. So we want that to be resolved too. So when everything flows in your body, then you can achieve health. The second thing to think about is reserve. And obviously, if you have a fish pond, then if there's no water, if the water in your reservoir is low, then it's not going to be good. And the same thing for your body. We want to make sure you're not too exhausted or depleted. In these days and age, we're all emotionally, physically, and mentally depleted for one thing or another. It's important to take time to recharge yourself. So keep in mind, pay attention to how much reserve you have. And if certain people or certain things makes you feel depleted, feel drained out, then maybe it's better to try to avoid those. Whereas other things that you feel like they're supplementing you, they're supporting you and getting you stronger, maybe you should lean forward more toward the supportive side. And ultimately, we want to achieve a balance. Just like a garden, if everything is just water and nothing else, then it's not going to be good. Or if everything is just trees and there's nothing else, that's not good either. The same thing with your body. We don't want too much of something, but not enough of everything else. So we see the concept of balance everywhere. we need a balance between attacking the cancer and supporting your body. We want to have a well-balanced diet. So even if something that's good for you, you shouldn't eat too much. And we want you to, do exercise, but not overdo it. So think about balance in every aspect of things that you do. And lastly, cancer is I think it's a unique disease because it comes from inside your body. It's not like COVID or infection where it comes from outside. But cancer cells, they were originally your own body cells. These were good cells in your body before, but somehow something went wrong and they became cancerous. So I also feel that true healing happens to come within your body as well. So do a lot of self-reflection, trying to find peace within yourself. And again, I cannot emphasize enough the importance of emotions and how it connects to your body. And emotions is really the basis of everything. And to fight cancer, you really have to be in the strong mind for that. Always believe that you can take charge of your own health, especially the lifestyle things that we talked about earlier, and make use of all the supports that you can find. Even though all of us outside, we cannot guarantee that we can cure your cancer, but at least we can offer a lot of supports that we can give you to help you along the process. And that's all I have for now. And I'm happy to answer any questions.
Okay, thank you, Dr. Sang.
Sure.
Yeah, I just asked those who are on to send the questions through the chat, and then I will and then if you can see them. If not, I can then read them to you.
Okay, great.
Okay. All right. So those who on the webinar, if you can put your question in the chat, that would be great, and then that will allow us to get the chat, also get the question, and then be able to pass it on to Dr. Sang so he can answer the question. Dr. Sang, I have a question.
Sure.
And that question is, what is the process for primary care to go over labs that you may have requested? Can the primary care provider go over labs that you requested, or are you the only one that go over the labs that you request?
Yeah, typically for the labs that we requested, we try to take care of that on our own. So we usually would contact the patient or set up another appointment after the blood test to go over that. But sometimes it's in the system, and sometimes the primary care doctors get alerted if it's really abnormal. In those cases, they may talk to the patient to take care of the emergency issue, and then we will talk to the patient afterward to take care of the less urgent issue or more cancer related. Because sometimes we do blood tests, but then we find out something that's not cancer related, and those would be kind of in the primary care doctor's realm. Yeah, so it's more like a co-management type situation.
Okay, thank you.
Sure.
Are there any other questions, attendees?
No one?
Okay, I got one.
Okay.
Another one is the question is you talked of numbers for stages, um, but a patient was giving a letter A with their stage. What does that mean?
It's yeah. There's some cancer that we stage like stage 1A or B or C, and then there's some cancer that we do A, B, and C. So it's a little bit different. Majority of the cancer we stage from 1 to 4, but there's some blood cancer that is A, B, or C, and then we use the letter on top of the number sometimes, like stage 1A, for example, or stage 3B, for example.
Okay.
Yeah, so it depends on the specific cancer and situation.
Okay. Thank you.
Sure.
All right. Another question is, do you support a COVID vaccine if you're undergoing chemotherapy?
Yeah, that's a common question that we get, and we don't know exactly for sure, but the cancer experts, we extrapolate the research information from other vaccine that we give, and generally we don't like to give vaccine like 1 or 2 weeks after each chemo because it can affect your immune system. And if you get the vaccine, then your immune system may not be stimulated enough to make the vaccine effective. So if you're on chemo and it's time for you to get the COVID vaccine, then I would say wait at least a couple weeks after the chemo. And probably the best time to get the vaccine is just a few days before your next chemo, as that's when your immune system is the best. Yeah, and that will make sure the vaccine is most effective.
Okay, I think that may be all the questions.
Okay.
All right, last call for last remaining questions before we end this segment. Well, if you don't have any questions now, don't worry. For the next month or every month, this cancer series will be ongoing. So there'll be another topic in regards to cancer. So for example, next month, February 24th, the topic will be proper nutrition. Proper nutrition. So stay tuned for that. Thank you, Dr. Sang. And then in March, Dr. Sang is going to talk again, and his topic is going to be on dietary supplements for cancer risk and benefits. So feel free to jump on every month in regards to cancer and your health. Thank you all for jumping on, and I hope you have a good day and a good week.
Thank you.
Okay.